the first thing we do is just place our hands on the toes, trying not to squash the toes. We just hold them firm but gently, and here's where we'll take about 3 deep breaths just to encourage our clients to relax, but also it's time for you to relax into the treatment and connect in. First part of greeting the feet is the top, and we're just holding. And then we go to the bottom, which is the plantar aspect of the feet, and we mold our hands to the client's feet. And again, we're just holding here for maybe 3 breaths just to connect in with our client. Next thing we're going to do is place the hands on the dorsal aspect of the foot, and as far up as we can. You can go right up as far as the knee depending on where their trousers are. You don't want their trousers tight because that will cut off circulation and reduce energy flow. Hands run down the side of the leg and give the heels a pull. I'm just going to push this back a little bit. So effleurage up, down the sides, pull the heels towards you. Effleurage up, down the sides, pull the heels towards you. Then we do zigzag on the right foot first, so we're using our thumbs just to zigzag all the way down the foot. Notice how my elbow goes up, so I'm not squashing myself or my client's other foot. We move one hand at a time to the opposite foot and do the same. Constantly checking in on your client's facial expressions. Here you might need a little bit of cream. You don't want to apply too much because you don't want it to be too slippy for the treatment. Then we're going to apply pressure to the solar plexus. So we locate the solar plexus, and you don't do this in every treatment, but just while you're practicing, we know that it's between zone 2 and 3 on the diaphragm line or reflex there. And I find best if you apply the pressure back this direction towards the back of the foot, the dorsal aspect, then direct your pressure upwards and medially, and then we have the solar plexus reflex. Can you feel that tenderness there? So it's important to talk to your clients when they feel the tenderness. If you notice a kind of flinch or a tightening, just to let them know that the tenderness will last maybe 10 seconds and that you're not going to increase the pressure once it goes away, that's the pain gone then. So we hold that for maybe 3 or 4 breaths. The longer you can spend treating the solar plexus at the start, the better, because it helps to really relax the client. But remember, you have a whole treatment to do as well. So then I like to treat the solar plexus dorsally as well. So we go between zone 2 and 3 on the dorsal aspect with our index finger. And the way I find best to treat this, we're on the diaphragm line on the dorsal aspect, press back towards the plantar and then direct your pressure down towards this area here. So back and down, but notice I'm not moving over the skin, I'm dragging the muscle. Can you feel that tender there? So then continuing on, keeping both feet exposed, we're going to move on to the right foot first, and we're going to open the longitudinal zones. On the right foot, we're going to hold the heel with the right hand and drag through the longitudinal zones. Just 3 times is enough. And then we're going to drag through, starting at the center, each of the transverse zones 3 times. So firm amount of pressure here. Down into waist and down into pelvic. Sometimes you see pelvic line called the heel line. Then we're going to rotate the foot. So I like to hold on the right foot the heel with your right hand, grab just under the metatarsal heads and rotate the foot 3 times in each direction. So I'm using my right hand to pull the heel as I rotate as well, and then go the opposite direction. So I'm using the left hand to rotate, but I'm also rotating the heel with my right hand. Then we're going to traction each of the toes, keeping your left hand where it is. Use your right hand to traction, which is pulling each of the toes. I like to use my index and middle finger here. You want a firm amount of pressure to get space in between the joints there to increase synovial fluid. And then after that, we apply our finger pressure. So if your client is awake or alert, you're going to instruct them to take a couple of deep breaths. And as their belly rises, we press in, and as it lowers, we release. We won't tell the client when to breathe in and out. We'll follow them. So when their belly rises next, we're going to apply pressure in between the toes and down this direction, working on the eye-ear area or the shoulder reflex. So I see her belly and chest rising. I'm going to apply pressure on the next one and release. Then we do the exact same on the other foot, which I'm just going to demonstrate quickly now to move through. So opening the zones, and notice how I move from one foot to the other. It's one hand at a time so I don't break contact. Opening the longitudinal zones, and again I'm speeding up here, so you're going to do it slower than this. Opening transverse zones. Three times in each. Then this time you're going to take the left hand under the left heel and rotate with the right hand. 3 times in one direction, 3 times in the other, using both hands to rotate the foot. Keeping the right hand where it is, use your left hand to traction each of the toes. And then use the index finger to press down as they breathe in and release as they breathe out the whole way along. And that is your greeting the feet, opening the zone. So now I'm going to cover the client's left foot, making sure that the toes are completely covered and wrapped up, because this foot is now going to be covered for about 25 minutes. So we want to make sure that it doesn't get cold. We will do some relaxation techniques on it before we treat it, just to make sure it's warm. And just have a look, make sure there's no toes poking out and that it's nicely, tightly wrapped. And now we're ready to start relaxation and treatment on the client's right foot. We'll always start on the right foot. Okay.